Dr. Pauling, lately, as a topic which is becoming very, very popular, it's in the newspaper all over the place, and even though directly it doesn't indicate that a dentist is involved, but it looks like there could be, and it looks like there is. And the thing is called sleep apnea. It looks like there is newspaper reports out there and television news out there where they're starting to realize that people in the afternoon, when they need a pick-me-up, literally a Coca-Cola or a coffee, a Red Bull, those type of energy drinks. And that one of the reasons they need that is because they're waking up dozens and dozens of times throughout the night. They stop breathing up to a minute or more many times a night, which is why they wake up, by the way, and they don't even know that. And it robs them of sleep tremendously, robs them of oxygen in the brain, and towards the afternoon they fall asleep. They say that they suspect more people having fatal car accidents than people drunk and drive. And in New Jersey, maybe a few months ago, a bus driver wrapped a bus around a ball, killed quite a bunch of people in it, and they suspect sleep apnea because those people just pass out like boom. And sleep apnea can be fixed with, of course, what's called a CPAP machine, which basically just pushes, oxygen, actually not oxygen, just normal air into the mouth. But it's an awful inconvenient thing to wear. Most people, except if it's a life and death, if there's a very, 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 very heavy sleep apnea, they simply will not wear it. However, a mouth guard, almost like a mouth guard when you box kind of thing, seems to be arranging it, and it might not be quite as good as the CPAP machine, but it is wonderfully good and usually fixes the problem. Is that true?
Yeah, that is definitely true. All those things that you mentioned. The CPAP is definitely, the standard, but the compliance is terrible. It's probably hard.
Like an alien, you need to sleep to have that machine. You can't turn. I heard it makes a lot of noise. So if you have a partner, if you think the partner gets waken up with the snoring, just see how he gets woken up with that damn machine. That type of stuff I have heard.
Right, and it's not going to help you sleep better if you can't sleep with the machine on. So there are dental appliances available that. A lot of what causes sleep apnea is the positioning of your esophagus, kind of closing off your airway. And what the dental appliances do is they help reposition your jaw, and that opens up your airway and allowing you to have that constant breathing. They also have snoring is related to sleep apnea, and they have appliances available that help with that. And if the snoring appliances don't help you sleep better, I imagine they'll help your spouse sleep better.
Right. So basically what you're saying here is, first of all, it apparently, you didn't maybe say that, but I'm asking you a question here. Most people who have sleep apnea also snore, or the other way around. Most people who snore have some type of sleep apnea. Not necessarily all of them, and they're probably decrease, but it's a pretty good guess. So if a person who snores, and at the same time he knows he snores, as long as he has a partner, he will know. Somewhere along the line it will come up. Maybe if he's totally alone, he might not know he snores. But if he has a partner, he snores, and he will know about it. If at the same token he also feels a little sluggish in the afternoon, kind of no real good reason, except maybe some MDs telling him you're getting old, and that doesn't make quite sense. Anyway, the chances are that he has some form of sleep apnea. Stop sleeping is pretty high. And since he needs to get rid of the snoring anyway, for the sake of his partner, just go do it, and you most likely will feel better literally immediately, because a sleep apnea appliance, whether it's the mask, as long as you can sleep if you have it on, or the appliance is a little bit like with glasses. It's if you wear them, you see. If you don't wear them, you don't see. It's that simple, apparently. Is that correct?
Yeah, that's right. Those appliances are available to help you breathe through the night and to sleep much better.
So even if you didn't have sleep apnea, at least your partner now can sleep because you have a silent night, basically, you know?
That's right.
Absolutely wonderful. And if you did have sleep apnea, you will immediately see an increase of energy throughout the day. And over a long time being deprived of oxygen, that couldn't be a good thing. I don't know, but what do you think?
Yeah, definitely. Not getting enough sleep, I think, plagues everybody out there. And so anything to improve that is definitely worth looking into.
Right, and those appliances made by a dentist, the kind of mouth guards, the snoring guards, sleep apnea guards, all kind of more or less the same thing, right? Or it completely, they are much, much less expensive than the CPAP machine on top of it, right?
Yes, they're definitely simpler and less expensive.
And if you travel, they're easy to put in the pocket compared to a big machine which has to pump air into your big mask, right?
Right, much more convenient.
Much more convenient. Well, all right, wonderful. And obviously in your office you do provide this service, am I correct there?
That's something that we're working on.
All right, thank you very much.